One of the main ways, there's a couple ways that we see contraindications happen with herbs. So one of these kind of subcategories, I would say, is metabolism, right? So if we're thinking about the way drugs work, we tend to think of it in terms of their pharmacokinetics and their pharmacodynamics, right? How is that drug absorbed, distributed, transformed, circulated, which is like pharmacokinetics. How does it move through the body? And then the pharmacodynamics is, when that drug gets to its binding site, what is the effect, right? What is that drug changing, shifting? How is it adjusting our physiology, our biochemistry to bring about a particular effect? And then after that, there's more pharmacokinetics in terms of how is that drug then cleared from the body? How is its waste products, or how is it further metabolized? And then how is it excreted from the body? So many herbs can affect this process of drug metabolism. And what we see in some cases is that sometimes herbs can speed up the metabolism of a drug, making it decrease its levels in the bloodstream, or it can slow it down, essentially prolonging the effect of that drug. So typically they're affecting the pharmacokinetics of the drug. And these are the really, really important types of interactions to be aware of, especially when we're talking about drugs that have what are referred to as a narrow therapeutic index. That means that this drug has to stay in a very narrow window of blood levels in order for it to be effective. If it drops below that, the drug's not going to do its job. If it goes above that, it can be harmful, right? It can cause problems. And a really common drug that tends to have a narrow therapeutic index is warfarin, right? A lot of people take warfarin for cardiovascular issues and things like that. It's a very common drug, and we need to be aware of that. And once again, we see St. John's wort is a big one here with drug metabolism, because St. John's wort, we all think of it as like this puncture wound herb or an antidepressive herb. But the thing that commonly gets overlooked with St. John's wort, this is a liver plant, right? St. John's wort is having a very profound effect on the liver, specifically a process that is referred to as phase 1 liver detoxification. And there's a whole kind of complex of enzymes that are referred to as cytochrome P450. And these are basically detoxification pathways that transform, metabolize, break down things in the body that then prepares them for phase 2 liver detoxification, which actually gets them out of the body. St. John's wort, through its effects on cytochrome P450 pathways, oftentimes reduces the blood levels of a drug, rendering it less effective. So if someone's taking a drug for something really, really serious, and they need to have a certain blood level of it, otherwise, their health is severely impacted, and they start taking St. John's wort, it's going to reduce that efficacy. In other instances, it can actually increase plasma levels of the drug, which again can cause further issues. So metabolism, oftentimes these are going to be herbs that are operating through the liver. It is possible elsewhere in the body, but the liver is really the primary organ that is responsible for metabolizing those waste products. Now, the other part of contraindications that we see between herbs and drugs that can happen is herbs that affect absorption. So we've got, the metabolism side once the thing enters the body, but then we have herbs that can affect how well a drug is absorbed through the gastrointestinal tract. So we see, again, either an herb can enhance absorption, or it can decrease or 100% prevent absorption. So an interesting example of this would be prickly ash, or Xanthoxylum claviherculitis. Is a really pungent, aromatic, diffusive, circulatory stimulant. Really useful for like nerve pain, peripheral circulation deficiency, and things like that. But it's a GI stimulant, right? It really stimulates and enhances absorption of things in general. Also, we see this with a lot of citrus fruits, right? Enhance absorption. So if your body, if your doctor is given a drug that it needs to be absorbed at a certain rate, in order for it to be effective, and then you introduce something like prickly ash, and all of a sudden that drug's being absorbed way more rapidly, this can affect the plasma levels of that drug and potentially lead to issues. The other side of this we have are herbs that contain a high level of mucilaginous polysaccharides, or demulcents, right? Slippery elm, marshmallow, things like that. Well, those mucilaginous polysaccharides can really prevent absorption of certain, not just drugs, but nutrients and minerals and things like that. So typically if you're drinking like slippery elm gruel or marshmallow, thick mucilaginous marshmallow decoction, to treat dryness, constitutional dryness, etc., you usually need to make sure you take those separately from medications because it will impact their absorption. Tannins, tannin-rich herbs, oak bark, witch hazel, lady's mantle, things that are really astringent can also affect absorption. Especially we see that with minerals, but tannins also precipitate alkaloids. So there is potential for interactions between tannin-rich herbs and alkaloidal medications, or even other alkaloidal herbs. So these are some of the ways that I tend to kind of think about herb-drug interactions. And they're, like I said, they're not all bad. Some of these interactions can be really good. So I think it comes down to the point of, right, herb-drug interactions, fact, fiction, or somewhere in between. I would say that it's somewhere in between. Like, herb-drug interactions happen, for sure. That is a fact, right? That some herbs interact with some drugs. So that is a fact. I think the fiction comes in where I see sometimes people, this is very common more with MDs that maybe usually aren't very aware of herbal medicines. They don't know how herbal medicines work. And so they just take the safe route and say, if you're on medications, just don't take herbs, don't take supplements for fear of interactions. And I think this is the most conservative approach. And I think it's due because they want to protect their patients, right? It's not because like herbs are evil or anything like that. I think it's more the doctors just want to make sure their patients are safe, which I really respect. And I think it's good, but it is also a very conservative approach. Not all herbal medicines have negative interactions with drugs. And the truth is that serious herb-drug interactions are really rare. Like, there is not very many well-documented severe interactions between herbal medicines and prescription drugs. I'm not saying they don't exist, right? I mean, that would be silly if I said they don't exist, because there have been documented cases, but really serious ones are pretty uncommon. And what we see is way more common is drug-drug interactions, right? This is really overlooked a lot of the time. And drug-drug interactions tend to be significantly more severe because, let's face it, our plants aren't as strong as drugs. They're just not. They have much more biochemical complexity than isolated, singular, targeted, silver bullet kind of drugs, right? But they're not nearly as concentrated as drugs are, and therefore, most herbs in that way are significantly milder in their effects than prescription drugs. And a lot of drugs are really strong in their effects, and too strong more often than not for our herbs to really cause a lot of problems, right?